Tuberculosis, called TB for short, is a common and sometimes deadly infectious disease that is passed on to others from people with active and untreated TB disease. TB is spread by singing, sneezing, or even simply talking, as tiny droplets of saliva or mucus are expelled into the air and inhaled by others. It can take weeks or even months for the TB disease to develop.
Hi, I'm Sharon Cole. I'm one of the nurse practitioners at UMass Lowell in the Health Service Department. Someone that has weight loss, that has fever, that has night sweats, that has poor appetite.
By the time any of these TB symptoms appear, the person with active tuberculosis disease has spread it among other people. Close contacts, such as family, friends, and coworkers that have shared airspace, are at the greatest risk for infection. There should be no blame or stigma attached to the disease, because everyone has to breathe.
Yes, if someone's family member has active TB, based on the risk factors, they've been in close proximity with them, might have had exposure. That's called a latent TB infection, where someone actually breathes the bacteria in, it's dormant in their body, it's not causing any illness. 9 out of 10 people in their lifetime, if they have latent TB, it will cause no problem. But in 1 out of 10 persons, it will. 10% of patients exposed will convert to active tuberculosis. So for that reason, it's very important that patients be screened and start on medicines to prevent active tuberculosis.
About a third of the population in the world is exposed to tuberculosis and at risk. However, the risk for infection is not the same for everyone. Worldwide each year, there are about 9 million new TB cases, and there are at least 2 million TB-related deaths.
My name is Mary from Dyson. I'm an assistant professor in the Department of Nursing at UMass Lowell. It's not necessary that everyone be tested for tuberculosis unless you're in a high-risk area. And high-risk areas would include healthcare workers, people that work in hospitals and long-term care facilities. Also, people that are in areas where there are a number of people, for example, nursing homes, shelters, prisons, or if someone is immunocompromised, such as if they have HIV/AIDS, or other immunosuppressive diseases such as cancer or diabetes, may put them at a higher risk for developing tuberculosis.
In Massachusetts, for example, there were 365 reported cases of tuberculosis in 2005. 14 cases were in Lowell, which makes Lowell the 4th highest reporting rate in the state.
If someone's been infected with the tuberculosis, which is the bacteria that causes TB, that means that they have that in their body, but it may not necessarily be causing disease. When you have active disease, that means that that bacteria is active within your body, and then you may have symptoms of tuberculosis.
Tuberculosis is a curable and preventable disease. If you have risk factors for TB, definitely get tested. Ask your doctor to do a Man-2 test. If the test is positive, you need a chest x-ray and evaluation by a doctor. The doctor will decide the kind of treatment that is needed. It is important to take the full prescription of medicine and to follow the directions given by the doctor.